Very good, Dr. Manesh. Thank you.
Well, thanks for coming in.
pleasure.
You had a chat with us about zirconia implants. How did you find us? How did you find our office and find the periodontist for your implants?
I was recommended by my dentist with SC Dental, and his name is Dr. Murray, and he spoke very highly of you, and he saw that I needed a sinus lift and said, "You are the best." And he said, so I went and got a consultation. He spoke with me, and I said, "Let's do it." Yeah.
I introduced the zirconia implants to you, and have you had implants before?
I have. I've had 2 implants. One back in 2003, and it's still doing fine. And I just had one in 2014, this year, by Dr. Murray. And he told me, since you're doing the sinus lift, that you would go ahead and do the implant as well.
And how was your experience overall with having
Excellent.
zirconia?
It was excellent from start to finish. Yeah.
Did you have any swelling or complications or any bleeding?
No, just normal after you did the sinus lift, pretty much. With the implant itself, no, not really. It went very smooth. I didn't have any complications at all.
As compared to the titanium implants that you had in the past, was it any different?
No, really, it wasn't.
It went very smooth.
Yeah, it went very smooth.
Okay. Were you nervous that there are not too many doctors that place zirconia implants in Southern California?
No, I wasn't. I highly recommend. I mean, any dental office I've gone to has been excellent, and I've been with SC Dental for years now. And so when he recommended you, I had no. It just didn't matter.
Right.
I trusted him. Yeah.
They've been placing zirconia implants in Europe for over 10 years, and I've been doing it personally for the last 5 years, and I've had great success with zirconia implants. As you know, there is 1 or 2% failure rate with titanium implants. I haven't had any failures with the zirconia implants in the past 5 years. And there are a lot of advantages with the zirconia implants. One being it's extremely tissue friendly, and the gum tissue loves the implant, and there is no inflammation around the implant. As a result, there is less bone loss, so it's very bone friendly as well. And the implant itself is shaped like a tooth. A front implant is shaped like a front tooth, and a molar implant back is shaped like a back tooth, a molar tooth. So as a result of that, there is less food trap with this type of implants because it's more naturally contoured, and it creates replace your tooth just the way your tooth used to be before it was lost. Now, how does it feel that now that the crown has been placed on this implant?
Perfect. The crown went on first time, which is not normal in my mouth when I've received a crown before. Yeah, it was smooth from start to finish, and it fits perfectly, and the bite itself is perfect.
How did your dentist feel about the zirconia implants?
Oh, he was very thrilled. Yes, yeah, he was very thrilled.
And how many times did it take you to do the implant? How many appointments?
Not many. I'm trying to remember.
Was it one appointment for the surgical phase?
But yes, yeah, it was one appointment, and then
one appointment previous to that for the sinus.
The sinus, yeah, sinus graft. But I came back periodically for you to check on it,
okay,
to make sure everything
just
was
for
healing properly. Yes, for the follow-ups.
Okay. Yeah. And then when you went back to your dentist, how many appointments did it take with him to place the crown?
One, I believe.
one appointment?
One appointment to do the fitting, and then the next appointment was to get the crown itself placed on there.
Okay. After the surgery, how many days did it take you to go back, after the implant placement, to go back to routine lifestyle?
Oh, right away. Nothing changed.
So the zirconia implant was not any different than
No.
any other surgeries. Now, you told us about your dentist. This was his first experience with this type of implant as well. So what were his thoughts on this?
Oh, he was very impressed.
Okay. And what instructions have you had from your general dentist or from our office about this type of implant?
Nothing different. Just go in for regular cleanings to keep everything up to date.
Okay. And this is the zirconia implant is a type of implant that is less likely to be rejected by the body as compared to titanium. And so we also want to see you once a year for cleaning and routine checkups. And the fact that you have a zirconia implant in your mouth makes it a lot more natural way of replacing a tooth versus any other metal. So it's a metal-free implant placement, tooth replacement for you.
That's great.
Well, Debbie, thank you for coming in.
Thank you. It's my
we
pleasure.
appreciate that, and we're very happy to have you as our patients and having you.
And it's been my pleasure to have
Thank you very much.
Good experience. Thank you.